To start with, you'll need to have a hand touch. Hannah here is just presenting her hand and marking the behaviour when Tori touches her hand with a yes and then reinforcing it. If your dog isn't going to touch your hand, get a bit of food and rub a bit of scent on your hand, which will make it more likely for them to investigate it. Then mark and reinforce. Once your dog is consistently touching your hand with their nose, start waiting for them to give you a bit more pressure. Then mark and reinforce that. With pressure, duration will naturally come. This does take a little while, however. If they offer a different behaviour as opposed to the hand touch, don't tell them off, just remove your hand and then present your hand again. Keep marking and reinforce the nose touch. Don't make your sessions too long. If they get bored, they'll get frustrated. Keep them simple and short and only do about 5-10 minutes every time. Once they start to get the nose touch, start doing it in different locations. Don't just practice it in one location. The more areas you practice it, the more generalised that behaviour will become. Once you've got a bit of duration, start adding in distractions. The distraction should be as simple as you moving your other hand initially, and then start touching them and then gradually progress from there.
Wait. Yes.
As a nose grab, so that if I need to actually hold it.
Good idea. So,
Once you've got the behaviour proofed well, try doing it at the vet's where you're going to have the final procedure done. Just start slow again, and if you need to take a few steps back, take a few steps back.
Leave it. Okay.
Touch. Yes.
Hannah's now adding the clippers. Tori needs to have a part shaved, so we need to get her used to the sound and just the appearance of clippers. We don't want to just quickly shave a part. That will potentially spook her.
Yes. Yeah.
If your dog stops participating, there's probably a reason for it. Don't tell them to do anything, just give them a little break and then offer the hand again. If they're going to go back and touch it, then they're ready for more.
Yes. Good girl. Touch. Yes. Go ahead. Yes. Touch.
Yes, we're dog trainers, but we do make mistakes as well. If you mess up and your dog gets a bit spooked, don't panic too much. Just go back a few steps and start again.
Sit. Touch.
If your dog starts getting a little bit frantic, it's probably a good indication that you should stop there. Remember, these sessions should only be about 5-10 minutes. Don't push it too fast too soon.
Tori, just coming on next to you, buddy. Good. Nice and good.
Start adding the distractions your dog's going to have to cope with. Here we've got the vet, but she's not actually going to be doing much. She's just going to be doing what Hannah asked her to do. In this case, simply placing her hand on Tori's neck.
Good work.
Notice how Hannah's hand is now above Tori's head. If that's what you're going to need at the end of the procedure, practice having your hand above the head when you ask the dog to touch.
Good, lovely bite. Nice job. You're so clever.
My one, Tori. Turn around a little bit. Good.
Because if you guys want to touch, and I'll show you what I'm looking for. So basically, where it pops up here,
Yep.
it's just a square in here would be fabulous.
So before Hannah actually did the shave, she made sure Tori was comfortable with that noise and pressure on her neck before she attempted it.
Shut up, man. Wait, Tori. Yeah. Wait.
Do you like ball?
As close to ball as possible, but I mean, if there's a wee bit of hair, it's not the end of the world. Like, is she having a dental procedure with us?
She might need to be referred.
Yeah. That's alright, what lumps do you need to manage to get some? Hey!
You look like a pot chicken. Is that good enough?
Yeah, that'd be perfect. And then, basically...
Notice Hannah didn't say yes or use the clicker there. She might have forgot. The good thing about using markers is if you do occasionally forget, it doesn't really matter.
Golden area, as far as I'm concerned. Yeah, run that all in it.
Ooh, yum.
And then it's 11:47.
Good.
So pretty much about 12 o'clock she should be all good to go.
You can get off, miss.
Good work.
Moment she's still.
Wait.
Good girl. Same thing. That's alright.
Now the sensation of a prick is being introduced, but with a toothpick, not the actual needle. We need her to get used to that sensation because that is previously what spooked her.
Nice work. You're so clever.
You do need a dog chair in here now.
Yeah, we do.
Good girl.
Wait.
That cat sounds horrendous.
Okay. Out of the way, boots.
Good girl. Wait.
Now we're actually introducing the needle. We need her to feel the actual sensation, so we're just placing it in gently and then removing it without taking any blood. We're just trying to get duration.
Good job. You did the thing.
What a
You
clever
did
dog.
the thing.
That was so good.
Thing.
So after lots of practice and a lot of repetitions, this was the first time that Hannah tried to do the full procedure with Tori. Now, it doesn't go to plan because we didn't train the last part. So what you'll notice, as soon as Tori feels the prick gone, she thinks the time is over and she gets up. That's not what we want. We need to do a final bit at the end.
Good girl.
Happy?
Think so. Wait.
Good girl.
Wait.
Good girl.
Wait.
Good girl.
Wait.
Good girl, Tori.
Can you just pop your finger quite firmly over there?
Yep.
Okay.
Good girl.
Wait. Yeah.
So what's happened here is Tori hasn't been taught the final bit of the procedure where we need to put some pressure on where the needle's been. She gets a bit confused and a little bit frantic and tries to leave. In her mind, it should be over by now. So what we need to do is then retrain the final part.
Good job. Just like that.
Good girl. Alright, should we give it a crack? Yeah.
Touch. Wait.
Good girl.
Here. Wait.
pre-GAs, aren't they?
We run a little off comment down the bottom. Point to not pass an unkept needle to a colleague. That's 40 seconds. No. Whenever we watch.
So that's the final outcome. What Hannah did after the previous one was then she went and taught more duration once the needle has been withdrawn. So Tori learns that she should wait, and then eventually she'll get the click and the reinforcement.
Other vet procedures online or on TV. We're like, oh my God, can you see a person not doing that with gloves? Judge. And now that I'm like, oh God, what was I doing wrong?